I'm pleased to tell you that unsightly appearing teeth can often be made to be beautiful and undetectable from natural teeth by placing a thin layer of plastic or ceramic over the surface of the natural tooth, a veneer. These restorations are well proven. They've been around for many years. This video will inform you about veneers, their advantages, their disadvantages, the treatment alternatives, the costs, and other important characteristics. I know that you're very familiar with contact lenses for eyes. They sit right on the surface of the eye, you can't even see them. Or false fingernails that are cemented onto natural fingernails. Tooth veneers are quite similar. They're thin, custom-made pieces of ceramic or plastic that are bonded to the carefully prepared surfaces of a natural tooth. These carefully made veneers are ceramic. They've been fabricated by a laboratory technician. They are as thin as an eggshell, or thicker in a few situations. When bonded to the surface of a tooth, they become as strong or really stronger than natural teeth. This patient has a tooth that's been trimmed down on a previous appointment. Veneers require 2 appointments usually. A weak acid has been placed on that prepared tooth surface on the second appointment to make the surface slightly rough microscopically. After this weak acid is washed off, a special bonding agent is placed on the tooth surface. Then the veneer is cemented onto the roughened tooth surface, making an extremely strong and beautiful, undetectable restoration. There are a few alternatives available instead of veneers depending on your clinical situation. They are tooth whitening for teeth that are in adequate positions but they're discolored. This is the most conservative procedures and the least expensive, but it may not apply to you. Bonding for teeth that are either decayed or discolored or pitted, as in this young woman who was elated with her new smile. This procedure is usually less expensive than veneers and requires 1 instead of 2 appointments. Or crowns or caps, as you know them, for teeth with extensive destruction, extremely poor positioning, or poor bite. The crown procedure is about the same cost as the veneer procedure, and additionally, it allows complete reforming of the bite and total change of appearance, but crowns require more removal of tooth structure. The alternatives for veneers are all excellent when they're indicated. Your dentist or dental hygienist will tell you which of the alternatives will best satisfy your oral needs. When indicated, veneers have been shown to be among the most beautiful and long-lasting of all tooth-colored dental restorations. When are veneers the best alternative? They are the best alternative when teeth are only minimally destroyed and aesthetically impaired, and they still have their chewing surfaces intact. When teeth are more extensively involved with decay, staining, wear or breakage, or they require major revision of the bite, crowns are usually better. Veneers can be used for teeth that have decay, and they often are, but they can also be used to correct teeth that have many other kinds of situations. Let's look at a few of them. Spaces between teeth, unequal lengths of teeth, teeth that have poor positioning in the dental arch, teeth that have a poor shape or have been worn down, discolorations or fillings in teeth that have discolored, crooked teeth, gum recession showing root surfaces. As you may know, the root surface of a tooth is a much darker color than the crown surface or the surface that's above the gum. The following before and after examples may be the same as the situations in your own mouth. You've now seen what can be corrected. Let's treat each situation with veneers. Veneers can easily close spaces between teeth by placing a very thin layer of ceramic over the front surface of the teeth with a thicker piece of ceramic between the teeth. The veneer does not extend onto the back surface of the tooth. Veneers can lengthen teeth by placing a very thin layer of ceramic over the front surface of the teeth and adding a thicker portion of ceramic on the biting edge of the teeth, thus giving the appearance of longer teeth. Veneers can reshape teeth by placing a very thin layer of ceramic on the front surface of the teeth and extending the ceramic wherever it is needed to make the teeth have normal contour and size. Observe how crooked these lower front teeth are in this middle-aged patient. Veneers can be used to build teeth to almost any reasonable contour. In the case of lower front teeth, you're observing this patient. You'll note that only 2 veneers have been placed to produce the profound improvement in appearance shown in the finished image. These teeth were also shaped by minor reshaping of the remaining teeth as well as contouring the gums in a minor way. If you're a middle-aged person or older and your lower teeth are crooked, this is an excellent treatment that's conservative and long-lasting. You'll need the help of your dentist to figure out what to do with your discolored or overly filled teeth. Sometimes veneers are excellent and sometimes they're not, so please get some help on this. Occasionally, teeth are deeply pigmented in their internal portion caused by various chemicals that were ingested during tooth formation. Covering dark colors requires removal of significantly more tooth structure than veneers on normal colored teeth, and crowns might be better, so talk to your dentist. Thicker veneers can be used to block the color of the underlying tooth structure, but in some cases, the crowns would produce a more pleasing aesthetic result and as well a stronger result. Your gums will recede. You have no choice. The root portion of any tooth is darker in color than the part of the tooth that extends into the mouth. When the gums do recede, that darker color is displayed and the result is not pleasing. Note the significant change in these teeth as veneers were used to cover the two-tone tooth color and to restore the teeth to normal contour and to a beautiful aesthetic result. I have observed virtually thousands of veneers over many years, and I can candidly say that veneers are among the most pleasing of all dental restorations to patients from an aesthetic standpoint. From a dentist standpoint, they're among the strongest of restorations if they're done properly. They're the most conservative as well. They don't require significant removal of tooth structure, just a slight amount. Veneers are extremely strong when they're attached to the dental enamel. Make sure you talk to your dentist about how much enamel or internal surface of the tooth, the dentin, must be removed. Ask your dentist if veneers are the best restoration for your oral needs. You've seen numerous different types of alternatives which may relate to you better than veneers. But between you, your dentist, and your hygienist, you'll be able to make the right decision.